Hey guys, how you doing? This is my first afternoon post-operative for my shoulder. I'll go through basically what they did, and I'll also go over what they require of me and what I require of them, I guess you could say. First thing that I got to come home with was a whole packet of a bunch of different things, because they send you home with pain pills. They have to send you home with a 4-page packet on opioid abuse and everything else. As you can see, I'm in my sling, but I was able to, I can move my hand now, I can move my arm. My forearm is still numb-ish. I can kind of feel pressure and it itches every once in a while, but you can't never get to the itch because the top layer of your skin's numb, so that kind of sucks a little bit. Basically what they did was they went into my shoulder and they cleaned up the minor tears. I had my rotator cuff, the minor tears in my labrum. They gave me a 1 centimeter gap between my acromion and my clavicle, which is basically your collarbone and kind of like the wing bone that goes down your back. And he ground down a little bit of my bicep tendon because there was a little bit of thickening in there. And that was one of the things that was creating the tendon impingement that I had, that clicking noise I was discussing before. The other thing they did, I had a couple bony spurs, so he went in and he ground all the heads of the bones down, made them the right shape. The one kind of resembled your knuckles. It had a bunch of little bumps on it, so he got that smooth, so now that's not clicking and grinding away at everything else when it rotates. So overall, first day post-operative, I guess I'm doing all right. I had my arm out of the sling for a little bit earlier. I was able to withstand the weight of my arm, so that was good. So the stuff they sent me home with, all my instructions, they have a sheet that tells you this is the stuff that we held for you while you were in your operation, like your pants, your belt. They basically itemize it like you're going to jail. I mean, right down to your wallet, if there's any money, credit cards, what credit cards and all that. But most people are smart enough. They just go in with a pair of sweatpants and a t-shirt, and that's all they really have with shoes. So that works out pretty well. This is a pretty extensive packet on. All this is about medications that I was, like the medications I am on and I was on. And then, like I said, there's 4 or 5 pages in there about opioid abuse and the warning signs of abusing them and all that kind of stuff. So, they send you home with a bunch of stuff that, is common sense, but it's all part of their job to cover their butt and make sure that you have a safe recovery and that they're not creating another issue for you down the road. One of the main things I have is this blue piece of paper right here. I don't know if you can really see it. But this blue piece of paper is basically my therapy prescription, which on here it has the diagnosis is they want me to, the therapy that they prescribed was for a shoulder debridement and clean out. It has my name, it has my birth date, it has the medical code. I have to go in and be evaluated and treated by the therapist before my therapy actually starts. So I'll probably schedule that for Monday for probably Tuesday if I can. They want me to go 2 to 3 times a week for 8 weeks. And they want me to follow like a basic shoulder protocol, which is no big deal because when I had my right one done, I went through the whole thing. So they didn't really go too in-depth with that because I already know what it is. I still have the packet here because I still do some of the exercises when that one acts up a little bit. And it's all the therapy is all to help with range of motion, mobilities, and different strengthening exercises. So they're going to be having me do rubber bands. They're going to have me walk my arm up a wall. They're going to have me holding my arms out. Then they're going to have me doing all that kind of stuff with weight in my hand. And then they're going to also be manually stretching me to make sure that everything's fine in there. So that's my therapy list. And then I also have a list of my home care that I have to do, you know, along with everything. And this is basically my care list for home, what I got to do. And as you can see up, let me see if I can get you close enough to read it. Right there, that was my doctor's name, Dr. McMillan. He has his own specialized discharge papers. One of the things that I like about him is he does do things a little bit differently. He does work on sports athletes and, you know, dancers and stuff like that. He does do, I guess you could say, some high-end work. So he's really good. I love what he did with my other shoulder. I rebounded well from that. I barely have any scars. You can see mainly one incision, which is where he did most of the work through. The other ones were just for cameras and irrigation, so to flush out everything that was in there. So basically, sorry I'm not looking up at you guys. I'm trying to read and wearing my glasses and being on medications, and also only being 18 hours after having my surgery done. I still have a little bit of the anesthesia in me, so sorry if I ramble. The dressing, the bandage can be removed 2 hours after my, 2 days after my surgery, which will be Sunday. I posted a picture of the bandage, and I also posted a picture of where they gave me the nerve block in my neck on Instagram. I think I have that link in my YouTube channel. So the other thing is, once I take the bandages off, I'm allowed to get a shower, but I'm not allowed to actually wash the incision area with soap. I'm allowed to let water run on it, but that's about it. I have to keep the steri strips on there for 2 weeks. If they don't come off in 2 weeks, I take them off myself. I have a post-op appointment 10 days after surgery, which is pretty normal. By that time, I'll be in therapy, and I'll be able to let him know how I feel, and if he needs to change the therapy at that point, he'll be able to. I can start getting a shower after I get the main bandage off, which is 2 days after. So tomorrow I can get a shower, which is going to be lovely. I'm sure my wife would appreciate it too. Weight bearing and crutches and things that I need to do to take care of myself in the future, and well, the near future, while I'm still in therapy and shortly after my surgery. Weight bearing status of my operative limb is as tolerated. Probably not the best thing to give me because I tolerate pain very well, so they should have probably said don't use it. I need to keep my sling on for use for 2 to 3 days as needed. So I'll probably have it on for most of today, and I'll try and take it off when I sleep. Last night sleeping was a nightmare. Every time I moved, it just sucked. It really did. I have a couple little exercises that I got to do, which is basically just the weight of my arm. I bend over and I let my arm hang, and then I just spin it around to try and get that motion back and to keep the tendons and ligaments in there loosened up until I get the therapy. And then once I get the therapy, that's going to be one of my home instructions I got to do. I already know the process of what I'm going to have to do, so it'll be pretty good for me. So as I can start doing the exercises before I start therapy, I'll be able to get started on the ones that I can tolerate, like lifting my arms up and rotating my arms out things that I can do like that, and just sitting here and rotating to make sure that the joint stays open and to make sure I don't have any issues. So that'll be good. Let's see. What's this one about? Analgesia, analgesics, which is basically pain meds. I can never get that right. Sorry, guys. I wish I could blame that on the meds, but it's not. You will be provided a pain script upon discharge. If you had a nerve block, it is important to start your pain medication prior to the block wearing off. Now, here's the funny thing. When you get a nerve block, basically what that does, it paralyzes that limb. So you can't use it. So up until probably about 8:30, 9 o'clock this morning, I couldn't even close my hands. So now I can close my hands and I can move my arm a little bit, but it's still numb. But when you're sleeping, you can't move your arms, so every time you move, you don't know your arm's there, but you feel it when it pulls, because it does deaden the nerve, but not inside. When that bone starts rubbing against itself, you still feel that. So, and when you're not having any feeling is when that's when it creates issues. That's why they don't want you to do anything for at least 24 hours after surgery. But I had to go get my script, so that's what I did. They also want me to be on a 325 milligrams of aspirin for a minimum of the next 2 weeks after surgery to minimize the chances of having a blood clot or anything like that. I also have what they call Cool Boy. It's basically it's a little unit that circulates 40-degree water through like a big shoulder. What would you call it, honey? My Cool Boy, that shoulder thing. It's like a big it's a circulating ice pack, and it's a real big shoulder harness that wraps around this arm and all the way around, so you don't have to sit there and hold on to it. And they want me to use that for an hour, minimally 5 times a day. So 5 hours a day, I literally have to just sit there with an ice pack on. But it works, so I use it. I think I have a picture up of me using it last night when I got home from surgery on my Instagram also. So if you guys wanted to take a look at that. And then here it says you may use ice as needed, but I was already prescribed something different than that, so that doesn't count. Physical therapy, I'm going to have to go in for that. If I have any questions, I have a phone number I can call. So that's basically everything. As you can see, I am doing pretty well. I mean, I'm not doing great by any means, but I can get up, I can move around. I shouldn't really be doing too much because I want to make sure that I don't further injure it, because like I said, I still don't have full feeling in that arm, so I could potentially hurt myself. But other than that, if you guys have any questions or any comments, you can, leave them down below. If you like this content, I'm probably going to be doing these videos. I'm thinking at least maybe every other day in the beginning, and then as I make progression, then I'll be doing them. Hopefully on top of my normal every week Friday or Saturday video. So yeah, I'm going to still try and cook, or me and Courtney will cook together, or I'm considering making a video on how to cook something when you're in this situation, because there's a lot of things that you can still do like this. So I'd like to thank everybody for all the concern and all the prayers and everything that you guys gave me on my other social media. That was greatly appreciated. And you guys have a nice day, and I'll see you on the next video.